After liposuction, I like to tell my patients what their recovery process is going to be like. I usually tell patients for the first couple of days they're going to be a little bit uncomfortable, but with pain medication and a compression garment, they'll do pretty well. And I always tell them it's very important to have some help at home for the first kind of week after surgery. As far as taking time off of work, I usually recommend patients take about a week off of work. I see patients the first couple of days after surgery, I see them a week after surgery, and they're usually feeling pretty well at about a week after liposuction surgery. What's also really important in the recovery process is post-operative massages after liposuction. The reason for that is liposuction creates some swelling and it can cause some fluid where we're doing the liposuction, and post-operative massages really help to get that fluid out and really smooth out that contour in the initial post-operative period. Post-operative massages are really crucial, in my opinion, after liposuction surgery. And the reason for that is it really helps mitigate and lessen the swelling after surgery. One of the benefits of our practice at SY Aesthetics is that in the office have a masseuse as well. So the patient comes after surgery and starts getting their post-op massages. And I'm right there as well in the office, so I always kind of say hello to the patient, peek into the room, look at all the areas where we perform liposuction as the patient's getting their massage. So I can always see kind of the results of the massage kind of developing. So if there's any questions at the time, I'm right there. They can always ask me, rather than a patient going to a different location where they're getting massages and the surgeon's not readily available there. So I think that's definitely one of the benefits of our practice. The first week after liposuction surgery, I usually tell patients following are their expectations. Take off a week from work. The first couple days you'll be pretty sore, but again, post-operative medications will make you feel a lot more comfortable. Actually, I promote walking. It's very important after surgery. You could do light things around the house. Every patient's really different. That's why I think surgery is very individualized. Some patients recover a lot quicker and some just feel sore for a couple more days than others. It's really important also, I tell patients to come see me after surgery, of course, because I want to make sure everything's looking great. And within that first week, I really emphasize that they begin their post-operative massages, because it's really important to help lessen the swelling. And of course, the compression garment, tell them to start wearing that. We actually put it on immediately after surgery. Compression garment after liposuction surgery, I think, is really crucial in the healing process. And what the compression does is where we perform liposuction, it kind of compresses that space down, so it prevents fluid from accumulating. Fluid is going to accumulate after liposuction surgery, it always will. But a compression garment helps lessen that fluid and kind of helps compress those spaces down so no fluid really builds up over time. As far as gym or strenuous activity, I'll tell patients usually it's about 2 to 3 weeks until they can get back to the gym, and everybody's kind of different. I tell them you could start with light aerobic exercise, walking on the treadmill, whether that's an incline or just kind of calmly walking. I don't think running full speed 2 weeks after liposuction surgery is something that they'll even want to do on their own. But usually first 2 weeks, I would tell them just relax and probably not going to want to do much. But after 2 weeks and compression garment and post-operative massages, once that swelling and starts to come down and their pain's well controlled, they'll usually want to get back into the gym and at least start doing some light walking.